Good morning, good afternoon, good evening. Here, actually, in the U.S., I'm in the good morning zone, I guess. So, 8:45. Anyway, thank you so much for the invitation to this prestigious presentation and conferences. So, today I will talk about food safety research at the Virginia State University in the USA. So, here is my contact information, and then probably some of you may not be familiar with where Virginia State University is because, I got supported by my school, so I need to talk about where we are at. So, anyway, so this is the United States of America, So, and then this is USA, and then the far right corner right here, just right below Washington, D.C., is where the Virginia State is. So Virginia State University is just in the middle of it. So today I'm going to talk about the importance of food safety research and the Virginia State University Food Safety and Microbiology program and what kind of research projects we are working on. Due to the globalization of food supply, it is virtually impossible for regulatory officials to continuously monitor all aspects of food safety. And that's one reason why the food safety is very important. And another is, as you all know, or some of you may be aware of it, some of you maybe not. You just hear about your neighbors, they got some sickness, illness, but may not be that, the fatal illness. But here is the statistics showing that the the Health Organization year 2020 reported that 600 million cases per year we have a foodborne illness, and that 420,000 people die. And even U.S. alone, Centers for Disease Control and Prevention 2018 reported that 48 million Americans, you know, infected with a foodborne disease per year, and 3,000 people die. So the you know and then cost of billions of dollars because of the sickness due to contaminated food, legal fees, increased insurance premiums, and medical expenses. The list go on. So now the question is, what are the major risk factors contributing to foodborne illness? Interestingly, you all know, but I just put it down in English, in words: inadequate cooking, such as undercooking, improper holding temperatures, contaminated equipment, food from unsafe sources, poor personal hygiene. Then now, if you think a little bit further, I know this is somewhere early morning, somewhere like evenings. So let me ask you this quick question to have your active participation in my presentation. Anybody can tell me what the common denominator for this list is? Of course, we are not, we cannot communicate because unfortunately we are, we are having a meeting virtually. So, of course, some of you probably guessed right. The common denominator of this is people like you and me. That's where it comes. Education and training of stakeholders are the key to food safety. Then what are the term stakeholders? Initially, I'm from different country. We are not, our main language is not English. So first, the stumbling block was what are the term stakeholders mean? So stakeholders meaning whoever handle food product like producers, processors, or consumers, or industry group, manufacturers, policymakers, vendors, store clerk, anybody who the involved in handling food product, they are stakeholders. So the food safety education is the most important thing to minimize any potential number of foodborne illness. So the our goal at the Food Safety and Microbiology program in the Virginia State University, is to improve the safety and quality of food supply through research, teaching, and extension outreach. Some of those research activities we do, is aiming to conduct food safety evaluations and their applications in controlling foodborne pathogens from farm to table, like including farm hygiene, post-harvest processing, distribution, and home appliance efficacy. And then particularly, you know, geographically unique, the situation we are in at Virginia State, we have a lot of small farmers because they were, the mainly depending upon that the tobacco leaf production because of the Marlboro, headquarters is in Virginia. Some of you, are a good fan of smoking, so you know we do have that the headquarters of Marlboro in Virginia. So what happened was, before, Virginia State had a buyout policy, meaning that any small farmers who produce tobacco leaves, state bought it. However, that the buyout policy has been expired. So those small farmers are desperately looking for some alternative crops for their income to replace. So that's what we are helping them to come up with some, the alternative crops, such as like a ginger or specialty crops, you name it, all kind of stuff. So aligning with the program theme, this study was conducted between school farms between Virginia State and Maryland State, which is neighboring state, right above the Washington, D.C. So at the farm level, what we did was, evaluated potential pathways and foodborne pathogen transmission between farm animals and wild birds. So from this study, what we found was sheep pose a greater risk than goats in regards to pathogen contamination at farms where there is co-grazing, and then no direct evidence of pathogen transmission between small ruminants and wild living birds was found. Because what we were trying to do is trying to establish or to see any, validation of our hypothesis, because the small ruminants, like has all kind of fecal materials all over the place, and that there happen to be a lot of birds, just on the wire, electric wire, and then they flock together, and what goes in must come out, and must come out, and then goes back in. So we want to look at it. So but from our data alone couldn't tell the any direct evidence, transmission of bacteria between wild birds and the small ruminants. However, very interesting thing is the intertransmission and shared contamination sources of Campylobacter among avian species was found, meaning that sorry, Campylobacter isolated from our farm at Virginia State University had the same genetic, DNA band patterns as the one isolated from the eastern shore. So that's a very interesting thing. So now the thing is, why sheep pose a greater risk than goats? That was a kind of interesting question, but obviously, as you see, there is a differences in goat and lamb foraging behavior. So sheep kind of graze on the closer to the soil. In the meantime, goat nibbles on the surface of the grass. So that may explain the observed differences in microbial levels in our study. And another study we looked at was, farm study again, Eastern Shore, Virginia, red round tomatoes contaminated with the salmonella was a big deal, like a source of, several multi-state outbreak within the last 10 years. So, we worked with the Virginia Health Department to look at if there is any kind of concern or any kind of association. So when we looked at it, we found, this is like again evaluating wildlife as a potential source of salmonella contamination for tomato grown in Virginia. So this study was done for 2 years, from 17 locations. And then we collected, 262 samples, and then these are the different kind of fecal materials we collected from. But from this study, I was a little somewhat shocked, or somewhat I was kind of interested in, was even snake, they produce fecal materials. I know, I may sound like a dumb, but I didn't know about it before. So so we collected some fecal materials from snake as well, and then we did some analysis, and then from this study, DNA band pattern comparisons using pulsed field gel electrophoresis of salmonella confirmed possible transmission of bacteria salmonella from wild living animals to tomatoes. That's what we found. And then all this, the presentation I had is on the far right corner, right bottom corner, there is a publication we made. So you can refer to it. And then as a, again, following step, once the tomatoes or product is the processed and produced, and it needs to be processed at post harvest processing. So in that theme, we investigate the effect of spray washing on the rebound of salmonella populations on Roma tomatoes during humid storage. So what this objective, actually the objective is simple, and then which everybody has common sense. Every food needs to be kept in cool condition, but not much of research has been done. So we wanted to look at what we know. Like grandparents, they probably didn't know about any research at all, but they always reprimand us. You need to keep this food, or like let's say milk, or those kind of fresh produce needs to be kept in the cool temperature. So is that real? Like how about the documentation? Let's run some testing. So this is a part of that kind of theme validation, meaning that we washed salmonella using brush washing, like very soft, so that it does not scratch or damage the surface of tomatoes. So we did wash the tomatoes, and then salmonella number was decreased by about 3 log. However, when after even reduction of that much of number, if we kept back at the a little bit warmer temperature, that number of bacteria on the salmonella on the surface of tomato rebound back to almost up to 4 logs. So again, no brainer. Uninterrupted cold storage for safer produce operations is very important. Again, this is the publication information right there. And then because particularly this pandemic, lots of people depending upon internet sales rather than going into the store in person. So what we did was we compared the microbial quality of food products available at local and at internet retail markets to see any difference of microbial quality, and then also price as well. So we worked on like a tilapia fish and internet meat, like lamb meat, goat meat, and then some of the mushrooms. So what we found was the again the high level of microbial counts and the occurrence of foodborne pathogens regardless where the food product comes from. So basically careful post purchase handling of product is recommended regardless of market source, whether it comes from internet or domestically. And then another theme is there are lots of home appliances available at like a large chain stores or retailers or like wholesalers, but how much of validation of the safety of the appliances are done, because we are somewhat blindfolded. Like they say they advertise on internet or on TV and it will work, but sometimes it may not work, may not have some scientific data to validate and support the efficacy of those products. So one of the product was we want to look at the ozone washing appliances to see if this one is really effective. Of course, this ozonated water itself reduced microbial cross contamination. However, washing did not significantly lower the counts of natural or inoculate microbes on tomatoes and green onions, which we used for this study. So, consumer, the discretion is very important here. So now, as a follow up, now recent project, what kind of recent project we do? So what we do is, again, we are located in Virginia, so we concern about the Virginians, if they are consuming, safe water. So as a part of it, we looked into characterization of E. coli isolate from residential water wells in South Central Virginia. So whether you believe or not, almost 2 million, of course America is an advanced country, however still some people like to go with the natural water. So almost 2 million Americans, I mean the South Virginians, depend on water wells for their water. So from this study, okay, this is a Virginia, and then this is particular area we studied. So what we found was almost 4% of 823 samples, you know, water well samples had E. coli, and then 3% of tested E. coli were multi-drug resistant, which meaning that we tried tested the water with 12, I mean the E. coli isolate from the water, using 12 antimicrobials, commonly used in doctor's office. So multi-drug resistance meaning that like at least those bacteria are resistant against you know three categories of antimicrobials we use, antibiotics we use. And then particularly 4 isolate were non-susceptible to more than 7 antimicrobials. This is really concerning. So we also want to look into if there is any matching PFG profiles, meaning that DNA fingerprinting, if those E. coli are coming from same source or not, so that we can help mitigating any transmission of E. coli. But no isolate had matching PFG profiles in this study. And another study is cryptic E. coli project, is to assess the prevalence of cryptic E. coli in the environment. Then now the question is, what is cryptic E. coli? We hear about like you are creepy or cryptic or something. So it's not like a secret agent thing, but what we did was, because E. coli bacteria are a common indicator of fecal contamination due to common the indicator of fecal contamination used to manage water quality. So, but some recent studies suggest that cryptic E. coli may be living in water environment, because current standard method of enumerating E. coli are unable to differentiate between E. coli and cryptic E. coli. The existence of cryptic E. coli may cause the false alarms of fecal pollution, meaning that it's not that serious, but they may say because of the fecal, I mean cryptic E. coli, they shoot up like there is a fecal contamination then higher than it is. So that's in that regard we collected water samples and fecal samples from several different places, like from the animal farms and natural environment, and then also the different the land uses like urban area, cropland and grassland, and the forest, somewhat far away from those wild animals. So we have collected 1,000 assumptive E. coli. We have collected, I mean we have isolated almost 1,000 assumptive E. coli so far, and then we are doing further analysis, so not necessarily using the traditional standard method, but also the PCR method to see any difference. So this is like traditional standard method suggest or advising us to use a MTEC agar to isolate E. coli, which is like a magenta color like this. So we are doing further analysis to confirm if they are E. coli or not, or cryptic E. coli. So now let's shift the gear a little bit here. If you look at this, so yummy, is that right? Like this is farmers market. I don't know your side of the world, but in Virginia now the farmers market, food production and the purchasing or transaction is like skyrocketing because of again corona thing and then COVID-19, and then the organic, all kind of things they come up with. So in that regard, what we did study was to assess. We studied, the assessment of microbial quality of food product acquired from farmers markets in Central Virginia prior to pandemic. That's the kind of stage one, phase one of farmers market project. So this is again, Virginia map, and then here is a kind of, you know, this is inset of Virginia map, and this is where the like this right there. There's in the green spots. Those are the where the farms are. But these people bring the product to farmers markets where the red spot right there. And then for your information, if you are familiar with the United States, particularly Virginia, this is the the state capital of Virginia, which is Richmond. So this is the about like a 50 kilometers from the our school. So the proximity. So what we found out is we collected 332 samples produced by 58 farms and sold at 12 farmers markets. And then highest level of coliforms were found in this cilantro and pork sausage, and Campylobacter E. coli, Listeria salmonella were detected, and at least one isolate from each species again exhibited multi-drug resistance. This is the published as well right here. And then for you to give you some visual like a like a what aid right here, if those bacteria are susceptible to antibiotics, they supposed to show clear zone around antibiotics applied on the surface of plate. But obviously right here, this one, no clear zone around 1 2 3 4 5 6 7 8. So how critical it is of those bacteria if somehow you got infected with it. But again, I'm not trying to scare you all. Like, it's not about the farmers market. Again, we support, we help, but just trying to give you what's going on, and then we can come up with some intervention method. So that was the phase one study. And then now, as a phase two study, we surveyed the differences in the prevalence of foodborne pathogens on food products sold at farmers markets in the Delmarva region, which is Delaware, Maryland, and Virginia during the pandemic, which is between August 2020 and December 2021. We are currently working on this. We have collected about the 1,000 samples produced by 50 farms and sold at 20 farmers markets. Again, this is where the study was done, neighboring states. So we again also, as a part of this study, we want to look at the whole genome sequencing, metagenomics. So if there is any difference of metagenomics of those bacteria, we isolate from 3 different regions, and then also look at any bacterial transmission, because they are neighboring states. So there is a kind of avian species migrating from one side to another. So that's a part of study too. And then this is the Virginia side, the map where that the farmers or growers have their product grow and then produce. And then these are the farmers markets where we went to. And then particularly as a pandemic going on, so like a social distancing, and then lots of signs all over the place, you need to wear the mask. And then this is the one of those few photos you may have some familiarity in your side of the country as well. This is another practice people are doing. And then another study was acclimation temperature project, which is we want to look at the temperature effects on bacteria tolerance in terms of the heat. Why this the project came up, it was kind of interesting. One day, some of students came by my office and asking if they can do some master's thesis work in my lab. Say, well, yeah, sure, why not? And then they are from Middle East country, and then they cover up all over the place. And then that is the summertime. We had a kind of air conditioner, had an air conditioning system broke down in my building, and I was like a scorching hot, but these guys seems to be okay. So that brought us to some concept. How about the bacteria? If they are incubated at like a little warmer temperature, they may be more resistant to heat. So that's how this idea came up. So prior incubation temperature influence the ability of bacteria to survive thermal treatment. This is also published right here there. So now, for just a short, the explanation, if bacteria is incubated at 45 degrees Celsius, they require about 12 minutes to reduce bacteria numbers by one log compared to the one incubated at 15 degrees Celsius, meaning that it takes just about 8.5 minutes to reduce their bacteria numbers. I mean the yeah, that's right, p value. And then food desert project, another is the food desert. What is food desert? It's different from Sahara desert, of course. This is where the people have limited access to affordable and nutritious food. And then residents of food desert often rely on small local grocery and convenience stores for fresh produce and raw meat. So that's another study we are working on currently. So, food safety risk associated with retail stores in food desert area, that's what we are looking into. And, what we found so far is significantly higher levels of food total microbial counts were found in food product acquired from small independently owned markets than those procured from large chain supermarkets. And food commodities and their packaging should be handled carefully regardless of market source. So we are working on this manuscript as well. So you will find a very interesting result from this. And then Probiotic Project. So one quail farmer complained One the quail farmer in Georgia complained about the high mortality of his birds due to Aspergillus fungus infection, while I was assisting another industry partner working on developing the probiotic product. So yeah, that is a kind of timely the inquiry. So we applied the probiotics on the quail. This is not quail because we were unable to get quail from Georgia because distance between Georgia and Virginia is quite like almost like 9 hours. So we used like chicken eggs to see how probiotics effective in mitigating or controlling Aspergillus fungus on the surface of eggs. So this is the control, and this is the one treated with a different like treatment, like such as bleach or like acetic acid and vinegars and like these probiotics. So their product probiotics completely inhibit the growth or at least spread of the fungus. So this is a very interesting finding. So that the quail farmer was so happy about it. So in my understanding, he's applying these probiotics to his farm. And then this is one example here is Aspergillus fungus is growing all over the place, but where the probiotics is, they suppress the growth or transmission of fungus toward that side. So that's and then one of those side stories is like prevalence of antimicrobial resistance in E. coli acquired from healthy individuals. In our building, we have all different kind of faculty and staff members. So one time I was interested in kind of getting preliminary data. So I have asked them kind of real arms twisted, and then kind of friendly inquiry if they can provide me fecal materials of their own so that I can run some testing. So they are healthy individuals, no health problem at all, and they have never taken antibiotics. Some of them they said. So here we found very interesting. So like the out of I think about 15 people, 80% of E. coli they donated, showed resistance against ampicillin, and then about 30% resistance against the streptomycin, and then like all like tetracycline like this. So it is very interesting. So I looked into further. So what happening here? Like this is the kind of top antimicrobial classes prescribed in the U.S. This is different levels, and then antimicrobial resistance bacteria, either from our study, not only from this human study, but also from the previous, all those E. coli we obtained from different sources. So here is the E. coli showing the resistance against antibiotics, and then E. coli showing the non-susceptible, meaning that either they are resistant or intermediate against the particular antibiotics. This is, the Salmonella, and this is C, means Campylobacter. So all these bacteria shows the same trend as the one top antimicrobial classes prescribed in the US. So that was very intriguing, like the results and the findings. So we are doing further study with this, and then what's really going on, like. And then again, at the end of my whole presentation, I would like to disclaim that studies conducted at the Food Safety and Microbiology program of Virginia State University was carried out mainly for academic research purpose without any conflict of interest. Furthermore, mention of trade names or commercial products in this presentation is solely for the purpose of providing specific information and does not imply recommendation of endorsement by Virginia State University. So again, no matter where the food come from, because again, wholeheartedly we trying to support and help farmers market and then large chain stores, because that's where our food product comes from. So now we know the some fact research based data. So now we are trying to use this information for the development of you know the training and the education material, so that we can bring them into our the conference room, so that we can educate them better, and then also appreciate them too, what they are going through. And then this is the all help USDA and the all industries, and then my people working in the lab. And then finally, I would like to leave my presentation, or close my presentation, with this very intriguing the photo I found the other day. Not only foodborne disease, but also pandemics associated with COVID-19, Ebola, Spanish flu, all natural disasters such as earthquake, volcanic eruption, global warming, and flooding. All things, I somehow feel that our globe where we live in is kind of suffering. So we may need some the healing from now on. Not only human people like us, but also Earth also needs some healing moment. That's all I have.